First of all, we recommend playing the explanatory 3D video or a testimonial while we place the technology. While the video is active, the first step is to clean the patient's feet and hands with alcohol and cotton, including the areas where we will place the directing electrode. Have the correct size of gloves and anklets ready for the patient: extra small, small, medium, large, or extra large. It is crucial for them to make contact with the skin. If not, the size of the gloves or the anklets, or both, must be changed. Later we will place the short cables. Pay attention that they are on the correct side of the limb, connected to the elastic or compressive anklets, taking into account that the yellow electrode remains on the tibial nerve behind the internal malleolus. It is important that no electrode remains on the sole of the foot. Check that it has been placed on the correct limb and that the color of the cable corresponds to the side of the limb. We will continue with the placement of the short cables connected to the elastic or compressive gloves. Make sure that the red, white, and blue electrodes are in the plexus of the wrist and that the red electrode is on the radial nerve. Once all the short cables have been placed, we will proceed to place the long cables in their respective colors. This procedure is carried out to avoid getting entangled with the cables. We proceed to place the directing electrodes that we are going to use during the treatment, having previously carried out a clinical reasoning and an approach strategy, objectives, programming, time, and intensities. Later we will use the cardio tool, medically validated electrocardiogram, to give a tangible feedback to the NESA non-invasive neuromodulation treatment patient. We will explain to the patient how to hold the cardio with their fingers without applying pressure. And we'll do what we call the 20-second test, where we apply in the cardio app a check of ANS, autonomous nervous system. The NESA XSIGNAL is programmed with P7 parasympathetic at high intensity, and after seeing the electrical activity of the ECG once or twice, we push start and we will see a change in the interaction of the electrical signals. We can push stop and we will see how it normalizes again. At this point, it is very important to make an analogy to the patient about his nervous system and explain that although he does not perceive anything physically during the treatment, he is modulating his entire organism. It is key to carry out this procedure the first time you come to session. cardio also allows HRV cardiac variability reports to be made with 5-minute baseline checks and 5-minute checks after NESA. Now we can start the treatment. If you are going to work in active therapy during the entire treatment or at the beginning, it is important to know that the short cables can be disconnected even when the device is on, so we are able to change the position of the patient. An important point to keep in mind is that the device can be removed from the cabinet and placed under the stretcher. The 220 centimeter cable allows you to work more comfortably during active therapy. It is advisable to have the treatment times controlled with a timer. Thank you for your attention.